Hi, my name is Ilona Pinter and I work for the Children's Society. We're a children's charity based in the UK, working with some of the most disadvantaged children and young people in the country. Each year we work with thousands of children and young people who are victims of violence, persecution and exploitation, including children who have been trafficked into the UK for exploitation. In my presentation today, I'm going to talk about the need for a child-centred approach to supporting and protecting trafficked children. Firstly, to begin my presentation, I'm going to set out some background information about the scale of human trafficking in the UK. Although the data held by local authorities and central government in the UK is limited, it does provide some context about the nature and scale of trafficking in the UK. According to the UK Human Trafficking Centre's annual assessment of the scale of trafficking, a total of 2,255 potential victims of human trafficking were identified in 2012 in the UK. Of these, over 500, or about a quarter, were children. Over half of the children, about 56%, were female and 38% were male, and in the remaining cases the gender was unknown. The most prevalent countries of origin for potential child victims of trafficking were Vietnam, Nigeria, Slovakia, Romania and the UK. The ages of child victims vary. With this assessment, most of the children were 16 and 17, accounting for about a quarter, although some were much younger, about 13% were aged up to 9 years old. In 23% of the cases, the potential victim was recorded as a child with no further information relating to their age. And for some of the individuals in this assessment, the age was unknown altogether. Although in many cases children will be exploited and abused in multiple ways, the most prevalent exploitation types suffered by children were sexual exploitation and criminal exploitation. Others were exploited as domestic servants, forced labourers, and in some cases the purposes of trafficking were unknown. I should add that it's generally agreed among NGOs and to some extent by government agencies as well that these figures are likely to be just the tip of the iceberg of the true extent of trafficking in the UK. It's recognised that many, particularly child victims of trafficking, will not come to the attention of agencies that can help them, or even where they do, they may not be correctly identified as victims of a crime or indeed as children. One of the key issues for government and agencies working in this field continues to be that trafficked children are at high risk of going missing from local authority care when they do find safety. There is no central data on how many trafficked children go missing each year and how many are later found. Few local authorities in the UK collect data about whether a child who has gone missing was a potential victim of trafficking or which country they were from, which is sometimes a proxy indicator. But some estimates say that about 60% of suspected child victims of trafficking in local authority care go missing, and the majority are never found. According to one assessment by the Child Exploitation and Online Protection Agency, CEOP, published in 2010, 18% of the children identified in the study were recorded as having gone missing from care at some point, and out of those, almost 80% were still recorded as missing at the time that the data was collected. Most victims go missing within 1 week and many within 48 hours, often before being even registered by social services. According to the CEOP report, Vietnamese children comprise the biggest identified profile of children who go missing, and make up almost 2/3 of the total number of potentially trafficked children who were still identified as missing when the case was submitted, the case data. Some of the reasons behind why children go missing relate to the fact that children are groomed by traffickers to return. Often they are terrified of what will happen to them or to their families, and they may have incurred significant debt which they owe to the traffickers. They have been groomed to believe that they must run away to return back to their traffickers. Of course, when these children do run away, they are in great danger often of being physically or sexually abused or exploited and being re-trafficked. In the UK, Vietnamese children at the moment are particularly at risk of criminal exploitation for cannabis cultivation. And those are some of the patterns that are emerging. In order to address some of these issues further, the UK Home Office commissioned the Refugee Council and the Children's Society to conduct a study into the practical care arrangements for children who've been trafficked into the UK for exploitation. The study had a series of key objectives. It was a 6-month review, and the main objectives were to explore the experiences of children who had been trafficked and were being cared for and supported by a local authority, to look at agency responses to child trafficking in the context of best practice guidance in child protection and safeguarding, to assess the multi-agency responses to supporting trafficked children, and to identify good practice and areas for improvement. The study consisted of 4 different elements. Firstly, a review of existing literature on child trafficking and support. Secondly, for the study, we conducted interviews with 17 young people who were trafficked when they were children. This included 15 girls and 2 boys who were trafficked between the ages of 9 and 17. They were trafficked from 9 different countries, and they had been supported by 8 different local authorities in areas within London, the South East and the West Midlands regions of England. The young people in the study had been trafficked for various types of exploitation, including domestic servitude, forced labour, including cannabis cultivation and drug trafficking, and sexual exploitation. The third part of the study was an online survey with local authority children's services. We received 52 responses to this survey, and that comprises 34%. That was a 34% response rate. Finally, we conducted 18 telephone interviews with stakeholders, with professionals, including 9 representatives from local authorities, from 6 different local authorities, solicitors and representatives from voluntary organisations specialising in working with trafficked children. The study identified a series of themes which I won't go into today, but I would encourage you to read the full report if you have a chance, and that's available on our website, and there'll be a link to this at the end of the presentation. For this presentation, I'm just going to focus on a few particular findings which I think are really crucial to the issue of children going missing from care, and they encapsulate some of the key issues concerning trafficked children and their protection. These relate primarily to how children are discovered and identified, and how they are then supported by local authorities and other agencies. Firstly, the young people in our study escaped their trafficking situation or were discovered in a number of different ways. Some escaped from their traffickers directly, and in one case, one child was helped out by a guard. In some of the cases, they were thrown out by the families, particularly in the domestic servitude cases. In some cases, they were picked up in brothels during raids by the authorities. In some cases, they were intercepted by officials at the border when they were being trafficked out of the UK. These are circumstances that led the children in the sample being made known to public authorities, but it's important to note that they were not necessarily immediately at these points identified as either being trafficked or as being children. The study found that the young people were subjected to a culture of disbelief. 2 children were treated as adults subject to immigration control and detained in immigration removal centres. In some cases, opportunities to protect them were being missed. For example, one girl called the police as she feared the violence of the male trafficker. The police arrived and questioned her in front of her trafficker and did not speak to her to verify his story that he was her father. This was despite the fact that he could not name her date of birth when he was asked. The children's documentation, immigration status, and questions about their age appeared to overshadow their identification as victims of abuse, as victims of a crime. And in some cases, there was a tendency to punish rather than protect the child. 3 of the girls in the study were sent to adult prison, 2 for documentation offences where they had been advised by the criminal solicitors to plead guilty. And in one case, the girl had pleaded guilty to an offence that she still to this day doesn't know what it was for. This quote from a young person, Hope, kind of encapsulates some of these experiences of not being believed about key aspects of their lives. Hope says, "It was very stressful for me, like all the time. She, the social worker, said, 'Well, you know what, I don't believe your age, I don't believe your name, and I don't believe where you say you're coming from.' She was like, 'We can offer you £5,000 for you to go back to your country.' She's still my social worker. She still don't believe me. But you know what? I don't really care anymore." As I mentioned before, a significant proportion of child trafficking victims are older teenagers. These children, as in the case with other separated migrant children seeking safety in the UK, are particularly at risk of having their age disputed by the authorities. Some of this is due to a lack of resources and finance within local authorities, a lack of any national guidance around how to conduct lawful age assessments when a child's age is unknown. For trafficked children, this is a particular problem since many will be trafficked into the country on false documents, and often these make them older than they are in order to avoid detection. Some of the young people in this study, and there were about 10 out of 17 of these young people had their age disputed, but all were eventually found to be children by the authorities. Some of them described quite perverse situations where the authorities took the age on their false documents to be their real age, even when they were being prosecuted for using a false document. Or they took the adult age to indicate that they were over 18, even when there was suspicion or belief that the young person had been trafficked. One 16-year-old boy explained how the false age on the passport, which said he was 37, was used to doubt the initial belief of the Home Office and the local authority that he was a child. The age assessment process poses a major barrier to children accessing effective support and safe accommodation. And obviously the experiences of age disputes meant that some young people underwent multiple age assessments, sometimes in police stations, and this had a significant impact on the young people, both in the way that it impacted on their ability to engage with statutory services and build trusting relationships with social workers, as well as undermining the process of rehabilitation and support. In some cases, this can pose serious child protection risks for a child if they're treated as an adult. I already mentioned some of the cases where children were detained with adults in detention centres, where they would have no supervision, and of course not being able to access child specialist support and rehabilitation. Children ending up in adult prisons. The study highlighted the risks for children who are placed in unsupervised accommodation, as they'd be at risk of going missing and being re-trafficked. And that was obviously a key concern raised by both stakeholders and through the young people's evidence. Christine, one of the young people in the study, highlighted, social service asked my foster mum to throw me out on the street. They say because now they done the age assessment, and also because you are illegal immigrant, that they don't want to have anything to do with me. I mean, all the children in the study were eventually found to be children by the authorities. So this just highlights the difficulties that that many experienced with getting adequate support where the age was being challenged. So the study considered the support provided to young people from their own perspective, as well as from the perspective of professionals and children's services. Although some of the young people expressed gratitude for the support they had received from individual social workers, and the fact that there was a system in place to support them, the majority, unfortunately, were generally quite critical of the support they received, and some had extremely negative experiences. The criticisms about social workers particularly centred around a lack of contact and support, a lack of consistency in the support, not being listened to, not being believed, not doing what they said they would do, and things not that should be being done, not being done. Some young people had multiple social workers, sometimes 6 or 7, and very intermittent contact. Some who had gone through age assessment processes understandably expressed a lack of trust after these experiences. There was a general lack of understanding of trafficked children's needs. For example, the needs to access specialist mental health services or provisions for their education. This relates particularly to the fact that some trafficked children may not speak the language, may not speak English when they arrive. I mean, in one case, one of the young people didn't know which country she was in fact. They generally will be extremely confused about their situation, about issues to do with understanding the different structures and processes that are in place. And children will have had potentially very limited formal education, if any, and will need additional support in order to be able to reach the levels of educational achievement as their peers. Accommodation was also a significant concern raised by both the young people and professionals. The appropriateness of some foster care placements was mentioned in some cases. For example, in one case, a young person was placed with a foster carer who seemed to then continue the domestic servitude which the young person had previously been subjected to by her traffickers. In another placement, the young person was extremely afraid of dogs, but was placed with a carer who had dogs. Quite a lot of the criticism around accommodation, particularly for stakeholders, was children being placed in inappropriate, unsupervised accommodation, such as bed and breakfasts and hostels without full-time carers. There were also concerns around placing children, or the fact that children weren't being placed out of the area where the traffickers might be able to locate them. In this example, Josephine, one of the young people that we spoke to, highlights the difficulties that she had with her key worker, the supervisor in her placement. I didn't have no one who really knew my case. My key worker was really bad. She took me to the supermarket and she made me feel like she didn't want people to see her with me. Like she's on her phone and she's far away from me, and I'm in a new country and I don't even know how to say rice or how to buy things. She didn't take me to no GP, no nothing. I'm going to end my presentation by looking at how we might start to develop a child-centred approach to protecting victims of trafficking. Within the study that we conducted, it wasn't possible to identify specific areas of good practice, since the interventions which have been tried generally not been independently evaluated. So our conclusions relied very much on what young people and stakeholders considered to be positive practice and things that worked well. I've summarised this in seven ideas, really. So our starting point should always be that trafficked children are children first and foremost, and our response to them should be a child protection response, no matter where the child is from, what documentation they have, or what their immigration status is, or what age they may be. It's absolutely essential that we start from this basis to ensure that their welfare is central to our decisions, and that policies and practice that are put in place support rather than undermine this aim. Number two is, let's use what we already have. Our study showed that despite existing government guidance on safeguarding children who may have been trafficked, few local areas were implementing these measures. And despite existing toolkits, these weren't always being used to help identify, assess the needs of, and take actions to protect trafficked children. So there's a great deal more that can be done with existing resources, and I've included links at the end of this presentation to a couple of them all. Number three is education, education, education. There's still a long way to go to ensure greater awareness about human trafficking, very much on the public, in the public arena, as well as among professionals. Among frontline professionals, greater awareness and training is needed with social workers, as well as with managers and other decision makers. There's a need for training particularly around trafficking indicators, how to spot potential victims, as well as how to respond effectively, including when children go missing. Protecting children is everyone's business. Although social workers will have a primary function with this, it's also healthcare professionals, youth offending services, immigration officials, police, and others who will come into contact with trafficked children, and it's crucial that they know how to spot signs of trafficking and how to respond. And that includes members of the public and NGO workers. In some of the examples in our study, it was actually members of the public, people from the local community, that were crucial in signposting young people to social services. Number five is the simple idea that every child needs a safe place to live and to call home. This means having full-time care and supervision, access to services like education and specialist mental health services in order to be able to recover from the abuse that they've suffered. But trafficked children need more than that. They also need access to sports and leisure activities and social activities so that they can develop other aspects of their lives which they haven't been able to so far, and that they can lead a normal life just like any other child. Children need to be part of their own safety plan. This is particularly important since trafficked children are made powerless by their experience of exploitation and manipulation by their traffickers. It's important that children are empowered to make decisions, and that where measures are taken which they may not agree with, that these things are explained to them in a way that they can understand, and that they are increasingly supported to be part of decisions about their safety. Finally, children need to have at least one person that they can build a trusting relationship with, someone who is assigned to them right from the start to make sure that they understand their rights, to help them navigate the complex systems that they come into contact with, like the care system, the immigration system, and the criminal justice system. They need an independent, trusted adult to make sure that if their age is disputed, that someone is going to be on their side to help them through it. Or if they go missing from care, that every effort is made to find them. An independent, trusted adult is needed to make sure that their best interests are always at the heart of decisions made about them. That's the end of my presentation. My contact details are available here. I'm very happy to take any questions, and I've included references to our report as well as to the guidance and toolkit I mentioned. Thank you.